Leaky gut may be worsening your autoimmune condition, or if autoimmune diseases run in your family, then it is very important for you to know about this. You may not get fully better, or you may need stronger medications if leaky gut is not addressed. Most people are probably not aware of it, but leaky gut could be one of the hidden factors that worsens inflammation and keeps your immune system overactive. Understanding leaky gut may help you better manage your symptoms and protect your long-term health. What is leaky gut? Your intestines aren't just digesting food. They form a protective barrier, almost like a fine mesh screen. This screen is designed to let nutrients and waters pass through while keeping bacteria, toxins, and undigested food particles out of your bloodstream. Leaky gut is also called increased intestinal permeability. Tiny openings can develop in the intestinal lining, allowing substances to slip through that normally would be blocked and cause your immune system to start overreacting. Why does this matter if you have or might develop an autoimmune disease? Autoimmune conditions occur when your immune system mistakenly targets your own tissues. If the gut barrier is compromised, your immune system may be exposed to more false alarms. This ongoing stimulation could worsen autoimmune disease inflammation and increase flares. In people with a genetic predisposition, leaky gut might even play a role in the development of an autoimmune disease. I'll give you an example. A patient of mine with rheumatoid arthritis noticed her joint pain flared every time she ate bread or fast food like French fries. She could not understand why these foods would affect her joints. But when I looked closer with specialized testing, it suggested that her gut health might be influencing her immune system. After focusing on gut-friendly nutrition and lowering processed foods, she reported fewer joint flares and more energy. Now, this doesn't mean that leaky gut explains everything or that diet alone cures autoimmune disease, but it shows how gut health can play a role in the overall problem. There are clues we look for that someone could have leaky gut. You may have bloating, gas, or abdominal discomfort. However, keep in mind that many people with leaky gut do not have any gastrointestinal problems. Also, having multiple complaints such as joint pain, fatigue, rashes, acne, brain fog, and headaches could be a sign that you are having a leaky gut. How is leaky gut diagnosed? While there is no single official test, certain specialized laboratory and stool tests are sometimes used to suggest increased gut permeability. Studies suggest that people with autoimmune conditions such as rheumatoid arthritis, lupus, multiple sclerosis, and type 1 diabetes may have higher rates of intestinal permeability. The ongoing inflammation from these conditions could weaken the gut barrier and make it leakier. Then this leaky gut allows substances like bacteria, toxins, and food particles to pass into the bloodstream. This may further worsen inflammation and the autoimmune disease. This can be a vicious cycle. Certain types of chronic inflammation may weaken the gut lining and make it more permeable. For example, conditions that directly inflame the intestines like Crohn's disease, ulcerative colitis, or celiac disease can damage the protective barrier. Other conditions or factors can worsen leaky gut. These include long-standing infections in the digestive tract such as bacterial, viral, or parasitic. Other possible causes of leaky gut include chronic NSAID or non-steroidal anti-inflammatory medication use, and if you have mold toxicity. So how should you treat leaky gut? First, identify and treat the underlying causes. If someone has celiac disease, a strict gluten-free diet is essential and can help the gut lining heal. With inflammatory bowel diseases like Crohn's disease or ulcerative colitis, medical therapy such as biologics or steroids may help reduce inflammation and allow the gut barrier to recover. Again, long-term use of NSAIDs may stress the gut lining, so reducing or stopping these medications can help. Also, treating intestinal infections or bacterial imbalances can be an important step towards restoring gut function. Next, elimination diets are when you remove common food triggers like gluten, dairy, soy, processed foods, and refined sugars from your diet to see if your symptoms improve. Usually you remove one of these at a time and see if it helps. An anti-inflammatory diet is recommended, and this includes vegetables, fruits, omega-3 fish, nuts, seeds, and olive oil. while cutting back on processed fats and sugars. Even if you don't have celiac disease, many people report benefits from a gluten-free diet. Foods like bone broth, chicken and fish skin, and beef are often recommended because they contain amino acids like glutamine and glycine that may help repair the gut lining. Stress, both physical and emotional, can directly affect the gut lining. Managing stress is an important part of gut healing. This can be done through meditation, yoga, and breathing exercises. Also, consistent sleep and moderate exercise support a healthier gut. There are various supplements that may help a leaky gut. Glutamine, an amino acid, is thought to fuel intestinal cells and decrease gut inflammation. Another is butyrate, and this is a natural anti-inflammatory for the gut lining. It can also help heal leaky gut. Sources of butyrate include fruits, vegetables, potatoes, and fermented foods. It is also available as a supplement. Also, zinc carnosine may protect and repair the gut lining. Probiotics and prebiotics can help restore a healthy gut bacterial balance. Omega-3 fatty acids can help calm intestinal inflammation. Low vitamin D levels are linked to both autoimmunity and poor gut barrier function. Additionally, herbal compounds such as turmeric, quercetin, and DGL may offer anti-inflammatory benefits for the intestines. Autoimmune conditions are complex, and no single explanation covers everything. But your gut is a major gateway to your immune system, and if that gateway is compromised, your whole body may feel the effects. That's why, if you already have an autoimmune disease, or if it runs in your family, it's worth learning about leaky gut. Supporting gut health may reduce inflammation, ease symptoms, and help protect your long-term well-being. Please leave a like and subscribe. This is educational information and not medical advice.